Hi! This is my first video on a new series I'm going to be doing on Lyme called What to Expect. And in this video I'm going to focus on what to expect before, during, and after PICC line insertion. The day before, or I guess the morning before, however much time you have to prepare mentally, I would give yourself as much time. I had almost zero time to kind of just like prepare my body, prepare my mind, to not go into freak out mode, because we call the hospital and usually, you know, it's booked, and you have to wait like a day or a week before you can go in and have the procedure done. That wasn't the case with us. We called it about 8 in the morning and they were like totally ready for me. So I had to go in and have it done right then and there. But even the hour I had to prepare really helped. I just calmed myself down and, you know, took deep breaths and sort of prepared myself. I know it might seem kind of strange to say this to you, because if you're watching this, you've probably been through hell and back with Lyme. But any procedure that I'm having done, I really need the extra time to just take a deep breath and kind of get inside my head and chill out. Some people take Xanax or Klonopin or something to calm them. I just took deep breaths and kind of visualized, you know, that this was going to be fine and it wasn't going to be harmful to me in any way, and the end result would be easy antibiotic therapy, which at the time sounded great because the oral antibiotics were upsetting my stomach. So my main tip would just be stay calm and let people pamper you. Let your parents or your girlfriend, boyfriend, brother, sister just kind of pamper you on that day, because it is kind of like a mini surgery. It's a procedure that should not be taken super lightly, and even if it isn't, you should still have the excuse to be pampered and loved. During the procedure, so you'll get to the hospital, you're gonna have to fill out the usual forms. I think it took about 10 minutes from start to finish to, you know, filling out the forms, and like it's an ordeal wherever you go, you know, explaining I have Lyme, that's why I'm here. And usually at these places they're very used to Lyme patients and they're very kind and accepting, so it's not the same, quite the same speculation and horror you get from like an ER or a non-Lyme literate physician. Usually these places are either having PICC lines inserted for, you know, a variety of diseases, but a lot of Lyme usually. So they'll be pretty, you know, accommodating from my experience. You'll have to, you know, fill out the forms, sit down, wait. Waiting is probably the hardest part of this procedure because you're letting your mind go wild. But just stay calm. Usually the wait's not too bad. The morning's better than lunch. If you go at about 12:31, that's when the lunch break happens for the nurses and doctors, and it's better to be either the first patient or the last patient. So I happen to be probably the first patient they had, and I was lucky. I got in and out really quickly. So when they take you in, usually it's done under radiology. They'll take an x-ray of your chest, heart, and they're going to try to find the vein, which is going to be the most durable and hold up to the catheter that they're going to place. They're going to use your non-dominant hand. So with me, it was my left hand, my left arm, excuse me, because I am right-handed. If you're left-handed, they'll use your right arm. That's pretty self-explanatory. And they'll run sort of like an ultrasound thing, looking for your best candidate, your best vein. It took a while with me just because my veins are so iffy and small. They're very tricky, really hard. That's why the PICC was so great for me, because IVs were always a disaster with me. My veins are tiny. So they found the vein up here. The scar is like about here. The placing varies from person to person. For me, it was right there. I have a teeny tiny scar. It's minuscule. And the only pain I felt during the procedure was just a little tiny pinprick, almost like a bee sting. And that is the local anesthetic and the number that they're going to use. After that, the whole thing only takes about 3 more minutes. They're just going to slice a tiny piece, make a really little cut, thread the catheter up through your vein and up through your heart. After that, they'll take another image, make sure they got the placing right. They'll ask you how you feel. You'll probably feel pressure, but I didn't feel any pain. It's going to feel a little bit weird, though, a little bit different, because it is a foreign object in your body. The most surprising part for me when the procedure was over was just that they said, "You're done," and I was expected to get up, and I felt really vulnerable and really fragile. And they make you undress for the procedure, so you have a gown on. And I remember thinking that there was no way I could get off the table and, you know, put my shirt back on and dress by myself. Just because I did feel very tender initially, and I did feel very, very fragile. But I got up and I did it. I was very, very careful, very wary. And they send you home with like a little, they didn't send me home with enough of a bandage, actually. I felt like it was too open, and so I went to like a CVS or Rite Aid and got an ace bandage and wrapped it around. I kept the ace bandage on it for about 3 days because I just felt like it was so heavy and dangling. I didn't want it to get caught or anything, and I didn't want it mainly to get damaged in my sleep when I was tossing and turning. So that is the during part. The whole thing is from start to finish. The procedure is about 5 minutes. Waiting time and the discharge time is probably going to vary from place to place, but it's really, really way quicker than I thought it would be, and much, much less painful. Honestly, the stuff that we go through daily with Lyme is so much harder and so much more painful than the little procedure of having a PICC line. Afterwards, you're gonna probably feel very sore for about 3 days. I went home and got in bed and was a baby about it and didn't want to move. I didn't think I could move my left arm. It took me about 3 days till I could feel confident in like lifting anything or moving my left arm. I was very scared in the beginning. About 24 hours after you have the PICC line inserted, it's recommended that you have it cleaned. Some people do the dressing changes and the cleaning on their own. I was never confident in my ability to do that, so my nurse came once a week. The first cleaning is going to be pretty tough, depending on how sensitive your skin is. My skin was super sensitive. The alcohol got to be too drying and too harsh for my skin, so we came up with a kind of a solution of peroxide and water, and that was how we cleaned my PICC line from there on out. But usually, if you're normal, you're gonna have the nurse probably just use alcohol, and it's gonna hurt, it's gonna sting. That area is gonna be sensitive and swollen for probably about 3 to 5 days. But the hardest part for me, just for about a week, after a week, everything's gonna seem normal. Life with the PICC is gonna seem just like normal life, trust me, after about a week. But for that little time when I was getting used to it, showering was the biggest ordeal. People have a lot of different methods for dealing with their showers with the PICC line. Some people use saran wrap and a Ziploc bag. Some people have, there's all different kinds of brands of PICC line covers. I'm going to link to the one I used at the bottom underneath this video. I can't remember the name of it right now, but it was a lifesaver. It made life so easy, and it was much better. I tried 3 PICC covers before I hit the lottery in terms of PICC covers, but the first one made me bruise really, really hard, very, very deep, like black and blue, and so when I finally found the right one, it totally changed everything. Showering became not such a hassle. The main thing, I guess, for the PICC maintenance and just having a PICC line is just to remember what a huge responsibility it is. And in my experience, doctors and nurses didn't take the time to explain it to me and sort of just very briefly just go over, you know, what this means, what are the benefits, what are the possible, you know, risks of having a PICC line, and, you know, what should I look for, and just explaining sort of the benefits and the risks as well. I mean, obviously, some of the risks are infections, if not maintained properly and cleaned properly, and also just being aware that you can ask for help and not taking on this whole thing by yourself if you can. I tried to be totally independent and maintain it and do my infusions by myself for about 5 weeks, and then I was just like, I gave up. It became a little bit too dangerous because when you're sick and weakened and in that state of mind where everything seems a little overwhelming, just do not be afraid to ask for assistance at all with this, because if you need it, then you need it, and the possible risks are not worth, you know, not asking for help. So that would definitely be my main piece of advice in terms of after the PICC, or after the insertion, just maintaining it, asking for help, and just taking care of your body, taking care of your PICC. When my PICC line was taken out, initially I was really scared. I thought that that having it taken out would be really painful. It didn't register with me that having the PICC taken out wouldn't be as painful as having the PICC taken in. Obviously, it would probably make better sense to you that it's not going to be as painful, but in my mind, I was really, really anxious about having it taken out. In reality, I just took a deep breath and my nurse pulled it out almost just exactly like pulling an IV line out. It took about 20 seconds and it was done. I put a Band-Aid over it, and I didn't shower or expose it to water or anything for 2 days. I didn't get a scar. I had sort of like a purplish mark for about 6 months, and then there's nothing now. It was, I don't know if you can, it was right there, and there's obviously no evidence. I'm like hypersensitive about scars after Lyme because I have many now, but that's not an issue with this, and even if it is, it's like, who's going to be looking right there? It's like a random spot. So after it's taken out, you do want to keep in mind that because you've had this PICC in for however long, probably a prolonged period of time, and because you haven't been using whichever arm you had your PICC in, it's going to be weaker, it's going to be smaller than the other arm. My left arm is still a little bit smaller than my right arm just because it was so underused for 2 or 3 months. So just take care of it. Just, you know, don't like go right into weightlifting immediately or anything like that. And you should be fine. And life post-PICC is a little bit easier than life with a PICC, but either way, it's a great tool and something that a lot of people have, and I know I was really grateful for my PICC when I had it in. It makes life with Lyme just a little bit easier, and definitely it's a great effective treatment. So that's what to expect before, during, and after PICC line insertion.